All right, listen to the statistic. People living in long-term care facilities, like nursing homes, make up about 0.6% of the entire U.S. population. Right now, they account for almost 28% of the nation's coronavirus deaths. The disease is just ravaging nursing homes around the country. And here's the thing, it does not have to be like this. We could protect these vulnerable populations. One assisted living facility in Connecticut has come up with an innovative solution on how to do it. Joining me now to talk about it is Tyson Belanger. He's the owner and director of Shady Oaks, an assisted living facility in Bristol, Connecticut. He wrote a New York Times op-ed titled "The Coronavirus is Killing Too Many Nursing Home Residents," detailing what his facility is doing to help fix this problem. Tyson, I wanted to start with a little bit of your story of how you came to be running this facility. I know you went to college, you did 3 tours in Iraq, if I'm not mistaken. How did you end up overseeing this facility?
Well, my parents got into senior care back in 1969, and they built Shady Oaks in about 1976. We were the second assisted living in all of Connecticut. Both my grandmothers lived here, and my mom might soon need our care.
And so you took over this facility.
Yeah, as I got through college, I went to Yale. I studied international relations. I've always had a strong sense of service that I learned from my parents. I admire my parents. I love my parents. And I thought what they did was wonderful here. And my sense of service brought me to the Marines. So after I graduated Yale, I joined the Marines. I served 5 deployments overseas, 3 tours in Iraq as an infantry officer. When I was done there, the thing that I felt really compelled to do was to try to research what went wrong. And so I got lucky. I got into Harvard, and I finished a PhD there in 2014. Right about that time, that's when my parents, their health began to decline, and it was this question, what to do with Shady Oaks? So I picked it up, I bought it, I moved next door, and I've been here for about 4 years now. I never thought I'd be back on the front line.
You are back on the front lines. You are now running this facility amidst this pandemic. Tell us generally what you have chosen to do here to attempt to protect both the staff and the residents in your facility. So
we've been watching the news out of Wuhan, in January. In February, the alarm really went up for me in seeing it spread to Italy, South Korea, and the Middle East. That was when we knew, this might be coming our way. Kirkland and what happened in the Life Care Center in Kirkland, Washington, I followed that very closely. It was crushing, and my heart goes out to the families and the staff who went through that. That was all alarms, that we got ready to go. We started buying equipment, buying the protective equipment, and in early March, we began having checkpoints to screen our staff. We shut down for visitors. What I did in those first few days is isolate. I went and I tried to do it myself, of deciding, okay, who could come in and who couldn't come in. And while I've been reading these articles, there's this thing that people have been talking about of asymptomatic or pre-symptomatic transmissions. And I got really frustrated, and I just felt like it just wasn't going to work. Out in Iraq, if we had that odds, those probabilities of someone getting to a checkpoint with a weapon, we would be pretty upset. And so I was upset here. It's just the same thing. I was up late nights that early March. I would wake up and with sweats in the middle of the night, and my brain was just trying to, just come up with something. March, I had the idea, hey, we all need to move in. And at that point, it was a little bit ahead of where most people were, and it wasn't easy. But I moved out of the house next door, which is where I've been living. I bought 5 trailers. Now I sleep in my office. I gave my house to my aides, and trailers go to our nurses and our cook. And this is what we do. This is what we did. On March 22nd, 17 staff members and I committed to living here for up to 2 months. It's actually now been stretched. We're looking to do until June 1st. The whole idea is that by not commuting, we wouldn't be bringing COVID-19 into our home. We wouldn't be bringing it in through asymptomatic or pre-symptomatic transmission. And we went from families, visitors, healthcare people, all kinds of people coming in and out of our home, down to 48 staff members who are commuting, then down to zero people coming in and out of our home. And the result is we have a safe place to live and work right now. And this idea, I didn't know for sure that it would work, but it succeeded. We feel safe. And so what I've been trying to do is to share the idea. I don't know exactly how it would apply in every home. Every home is going to have to figure it out for themselves. The one thing I do know is that we need government and charitable assistance so that senior homes are going to be able to afford to offer the right kind of incentives for staff to be able to do this. It's really hardship work. Our staff is working 60 to 80 hours a week, and they can't be with their families during a time of crisis. And if we make it to June 1st, which I'm thinking that we will, it'll be 10 weeks away. Now, as Marines, we sort of sign up knowing that that's what we're going to do. But it's a whole other thing to ask healthcare workers to do it. And they've done it. They're really heroes. They really deserve all the praise and for their heroic work that they're doing and keeping our home safe. Chris, I'm just grateful for the opportunity to share this idea. I hope people give this serious consideration. I don't want to be called a hero. I want us to be called a pilot project. I want us to be called, look at what they did. Can we see about doing it over here or over there? New York, New Jersey, Connecticut, we've been hit pretty hard. The rest of the country might be hit hard soon. We need to share the ideas of what worked in our states so that all Americans can benefit, so that all residents and all caregivers have an opportunity to bubble up.
And I should note, Tyson, that you are paying a tremendous amount of hazard pay to that staff that is working so hard, that's living on site. And part of the point that you make in the op-ed is that in order to afford this model would need federal assistance, but it is something that we should be looking to do as a society, not just individual pilot programs. Thank you for sharing your story tonight, Tyson. It's really an incredible story and inspiring. And I hope you, your staff, your residents all keep safe.
Chris, thank you.